There are urgent warnings for people to get their whooping cough vaccinations, with a massive spike in cases this year, the largest actually since 2015.
At the same time, there are also concerns over the number of meningococcal cases recorded in Australia this year too. Let's speak now to infectious diseases specialist at ANU, Sanjaya Senanayake. Sanjaya, great to have you back on this morning. Let's start off with whooping cough. What's behind this spike in cases?
So with whooping cough, we normally see an outbreak every 3 or 4 years as people's immunity wanes. But interestingly, the last big one we had was in 2016. So it's been about 8 years, and we can blame COVID for that. Because of all the social distancing, etc., that you'd remember during COVID, we saw a huge drop in a whole lot of respiratory infections, such as influenza and RSV. And of course now, as people have started moving together again, there's been a big rebound. People have been infecting each other, and with whooping cough our immunity is lower than normal, than it ever has been. So therefore we're seeing a lot more of it.
What are the symptoms that people need to watch out for with whooping cough, and why are newborn babies most at risk?
Look, in older people, it can be very hard to tell apart from other respiratory infections. You might have that typical prodrome where you feel a little bit off, you've got a bit of a runny nose, bit of a sore throat, and then the cough sets in. Now, it's known in Chinese as the cough of 100 days, so it can last very long, but so can coughs from other infections as well. So, and in adults and adolescents, it can be a milder infection, but in infants, it's very serious. It can kill. And there are a couple of reasons for that. One is the anatomy. So, these little babies, they've got wee little lungs and wee little airways. So if there's significant inflammation, it can be very hard for them to breathe. And secondly, it's an immunity question, because before 6 months of age, babies haven't had their first primary immunisation set of doses. And that can be offset somewhat by mothers who, when pregnant after 20 weeks, having a dose of the whooping cough vaccine. But we haven't got great data on it, but the figures show that the uptake's not brilliant for that.
How long does the vaccine last? Because I think there would be people who might think they're covered, but actually they haven't realised that their vaccine coverage has lapsed.
Yeah, that's a great question. So with the vaccine, in the past we used to use something called a whole cell vaccine, and that actually provided really good immunity, but that was at the expense of causing quite a few side effects. So we sort of moved to something called a acellular vaccine without cells, which is still pretty good, doesn't have as many side effects, but the immunity is maybe not as good as the whole cell vaccines. And what that means is that after about 10 years, your immunity from that vaccine has waned. And that probably starts within a couple of years of having the vaccine.
Let's move on to meningococcal. It can quickly progress into a serious illness. So what should people be looking out for?
Yeah, so in fact, Friday was World Sepsis Day, and sepsis is when an infection causes uncontrollable inflammation in the body, which can cause severe organ damage and death. And meningococcal disease is an important cause of sepsis. So it tends to make you sick very quickly. You can start off with a sore throat and feeling feverish, and then you can get a very distinctive rash all over your body and feel terribly unwell, which means you need to rush off to hospital. And some people can get meningitis, where the light bothers their eyes and they get a headache, but it tends to be a very acute illness.
What are the vaccines available for meningococcal? And when we see these spikes in both whooping cough cases and meningococcal, I guess it highlights the importance of vaccinations.
Yeah, look, in vaccination is certainly very important. In terms of the spike, for meningococcal disease, what I was just looking, it's about 88 cases that we've had notified this year, and that's not inconsistent with what we've seen in past years. And you have to put that into perspective that about 20 years ago, before the meningococcal C vaccine came in, we were seeing about 500 or 600 cases a year. So we're not doing too badly overall. But there are 2 vaccines, and one of them covers 4 strains of meningococcal disease, and the other one covers 1 strain, the B strain. And we found that if The B strain isn't fully covered in our national immunisation schedule, so not everyone gets it, and that tends to be the one which we are seeing in Australia. Most of the cases we see these days are B cases.